Thank you, Mr. Chairman. Secretary Kennedy, I think someone in the media told me this is your 7th appearance before a committee testifying. I can't think of any other cabinet secretary in the Trump cabinet who has been as transparent as you have been, and I appreciate you being here today. I appreciate your service. There's not a day that goes by when I don't hear from a Hoosier mom who tells me to tell you thank you for your leadership and what you're doing. And my wife is in the audience. She's right behind you. She wants me to tell you thank you as well. What you do for families all over this country, but especially in Indiana. What message do you have as we wind down this committee hearing for families that are counting on you and this team to make America healthier again?
People have been talking about measles all day long. But when my uncle was president, we spent zero on chronic disease in this country. Now we spend $4.3 trillion just in my agency. The military, Social Security spend more. Altogether, 48 cents out of every tax dollar paid to the federal government is going to health care. 90% of that is going to chronic disease. This is an existential issue. We have the highest chronic disease burden of any country in the world. 77% of American kids cannot qualify for military service. It's a national defense issue as well. Diabetes rate, juvenile diabetes have gone from essentially zero among children to 38% of our teens are diabetic or pre-diabetic. Autism rates have gone from 1 in 10,000 in 1970 to 1 in every 31 today. And we need to do something to protect our children. This has got to be our top priority. And infectious disease is important. And one of my jobs is to make sure to stem the outbreaks, which I've done with measles better than any country in the world. But we also can't just talk about that in exclusion to the thing that's really killing our country, which is poor health. During COVID, we had the highest death rate of any country on earth, the highest. So we did worse with COVID than any nation in the world. We had a death rate of 3,000 per million population. There are other countries that had 14 deaths per million population from COVID. And when you ask CDC, why did all these people die from COVID, Americans more than anybody else, they say it's because of our chronic disease epidemic. The average American who died had 3.8 chronic diseases. This was not an infectious disease that was killing healthy people. It was killing sick people. So the connection between chronic disease and infectious disease is there for everybody to see, but everybody ignores it. Every Democrat in this committee, all they wanted to do was talk about measles. And none of them, for years, they've talked about trying to reform the food. I'm doing it now. And they're doing everything in their power to impede me from doing it. So it's all partisanship, it's all tribalism, and it's not real.
It's crazy. I listen to their questions over and over again, and you've made so much progress, yet the Democrats have tried to obstruct everything that you just talked about trying to do to make this country healthier. I think it's totally shameful, and there are so many things that we have yet in the time that we have left with you as Secretary and President Trump in the White House, things to get done. And one thing that you and I have talked a lot about before is what China has done to dominate the pharmaceutical industry. And last year, 42% of clinical drug trials were conducted in China. It used to be 100% of them that were conducted in the United States. What are drug companies getting out of that? And can you talk about the threat of those drug trials occurring in China instead of in a safer environment in the U.S.?
I mean, they're getting faster clinical trials over there. And because we have a system that was designed, that typically a drug from conception to commercialization, because of the regulatory process, takes 15 years. And we can't afford to do that anymore. And Senator, one of the things—
Is it true that they're less safe? Obviously, they're less safe.
They're less safe. They're also breaking all kinds of ethical rules. They're, shanghaiing minority groups in China to participate in trials that they don't want to participate in. We're now doing inspections over there to catch that. More importantly, we need to compress the time from concept of commercialization in this country. And we have a bill we're going to put before Congress to try to compress the phase 1 trial and actually make it all a seamless phase 1, phase 2, phase 3. And that's going to help us. So I appreciate
We want to work with you on that.
support.
Thank you for your leadership, Mr. Secretary.
Thank you, Senator Banks.
Support journalism you trust. Support PBS News. Donate now, or even better, start a monthly contribution today.